Hi everyone, Dr. Lisa Vuich here. I'm going to be answering some frequently asked questions via video in this series, and today's video answers the question, can I be poisoned by cosmetic Botox? Now this question usually comes across in the form of, I've heard Botox is a toxin, I think it's a poison, I'm worried about putting a toxin in my face or getting botulism. Now, the word Botox tends to be used generically to describe all of the commercially available wrinkle relaxers, which in medicine we call neuromodulators, because they're medications that impact the transmission of signals from the nerve cells to the muscle cells, which would normally tell the muscles to contract. Now, there are actually now 5 different brands of botulinum toxin available on the market in the United States, and they're listed here. There's the original Botox cosmetic, which was approved initially in April 2002. There's Dysport, April 2009. Xeomin then came in July 2010. Jeuveau in February 2019. And most recently, Daxxify became available. It was FDA approved in September 2022. Now, obviously, the reason that we do botulinum toxin or tox is to look more refreshed. So you can imagine if you look at the image to the far left, the woman in the initial image looks like she might be concerned or sad or angry, disturbed in some way, tired or fatigued. This may not match at all how she's feeling on the inside. So when the tox kicks in, the certain areas or facial muscles relax, and you get a more fresh, a more serene look. The eyes look more open, the face looks more inviting, and the mood overall looks more positive. Of course, over time, the effect will gradually wear off. Now, for most of the toxins we have, that duration of effect is 3 to 4 months if the dose is adequate. But we now have Daxxify, which in studies actually had duration lasting 6 to 9 months for many clients. So that's been the newest advancement in the tox industry. Now, botulinum toxin was actually approved initially for use in an eye muscle disorder, eye muscle spasm called strabismus, and that was back in 1979. After that, doctors Alastair and Jean Carruthers from Canada got the idea to use tox in a cosmetic way to relax these muscles of facial expression, which would otherwise make a bunch of fine lines and wrinkles over time as well. And interestingly, Dr. Jean Carruthers was actually the lead investigator for the studies that recently brought Daxxify to the table here. So even more than 30 years later, the doctors Carruthers are still very much involved in tox development and research. Now, tox, either for cosmetic use or therapeutic use, has been extensively studied. As you see here in the clinicaltrials.gov site, there have been 674 completed studies on tox, and even now 93 studies currently actively enrolling patients. Now, botulism is a bacterial disease primarily caused by Clostridium botulinum. That is a bacteria that's actually found throughout our environment. In fact, even in honey, there are clostridial spores which can be present. So you might have heard, if you have young children, not to feed an infant honey under the age of about 12 months, and that's why. There is no Clostridium bacteria. There are no clostridial spores in any tox product, any of the neuromodulator products. Okay, so that is not a concern at all. Botulism as a bacterial disease is primarily something that results from ingestion. As I mentioned, honey is a possible source, but more commonly it's preserved or canned foods that have gone bad or weren't properly handled during that food preparation process. The safety profile for all of the commercially available products is quite similar. In fact, the product insert for Botox Cosmetic brand goes as far as to state there has not been a confirmed serious case of spread of toxin when Botox Cosmetic has been used at the recommended doses to treat frown lines, crow's feet, and or forehead lines. All of the toxins have a black box warning with the same verbiage in them. It's required by the FDA that that specific verbiage be there, saying that there's the potential for distant spread of effect. The most common treatment-related adverse events are a transient headache, discomfort at the injection site just from having injections, maybe some local redness, maybe minor swelling at the injection site, and less commonly, temporary relaxation of a muscle you didn't want to relax, such as like getting a lid droop, which is still uncommon, but certainly can happen. Another somewhat uncommon response would be a flu-like illness or just upper respiratory infection type symptoms after the injection. All of these things resolve easily over time. It is still not recommended for pregnant or breastfeeding women, primarily because we do not have studies that involved any pregnant or breastfeeding women. So even though we don't have reason to really suspect that the cosmetic tox would affect the fetus, we still cannot recommend it because of the lack of studies. Of greater concern, honestly, is what we call bootleg Botox. The word bootleg originates from the practice of smuggling illicit items in the legs of tall boots, especially smuggling alcohol back during the American Prohibition era. But the word over time, of course, has come to refer to any illegal or illicit product that's been transferred when it shouldn't have been, for example, from other countries. Unfortunately, there are still providers who are caught importing tox products of whatever brand from other countries, financially motivated because they can get it cheaper there. This is absolutely unacceptable. It is illegal. Who knows who's handled them, what temperature they were stored at, how long they've been stored, who had access to them. Could someone have contaminated some of the vials or replaced the contents with something else? We just don't have control over that because the vials are located outside the country, and thus it is illegal to import products from outside sources. Unfortunately, there's still some providers who've done that, as you can see, as recently as November of last year. A doctor in the California area was indicted for doing so. Overall, there's a very low incidence of adverse events. There are literally millions of botulinum toxin injections done every year. The American Society of Plastic Surgery statistics said that there were approximately 7.4 million injections of botulinum toxin and 2.6 million dermal filler injections in 2018. Now, that's likely an under representation of what actually goes on because not everyone reports what they're doing to the American Society of Plastic Surgery. So it is minimum that and likely much higher. When it's looked at in terms of studies of adverse events over time, you can see even in particular this study, which looked at 13 and a half years of tox injections, cosmetic users, only 36 adverse events that were considered serious. Now, a lid droop would be considered a serious side effect, just FYI. So 30 listed as possibly related to the tox products, 6 likely not related. Of course, there were no deaths. So their conclusion is that based on their review, serious adverse events were much more likely to be involved with therapeutic use. Now, therapeutic use means use for cerebral palsy with muscular spasm and other related sort of conditions. And in therapeutic use in general, many more units are being used at one time into much larger and more vascular areas than the relatively small doses that we use for facial aesthetics. And so there's the greater possibility of seeing adverse events when the dose is higher in therapeutic use. What I really recommend is that you be both curious and careful in selecting your injector. The key to a positive and safe experience, honestly, is utilizing a trusted and experienced or well-trained provider. I suggest that you avoid sort of one-off events, parties where you don't know the injector to be a local aesthetic expert. Groupon deals tend not to work out well. I can't tell you the number of times I've had clients come in after having been convinced to go to a Groupon event with a girlfriend or a guy friend or whomever, and invariably they come back and either I'm fixing something or they're saying it didn't work, it did nothing, it wasn't the same, it feels like a waste of money. And I don't know what went on there, but it's likely that they didn't get the product they thought they were getting or the dose they thought or were told that they were getting. That's the only thing I can come up with, in terms of why it suddenly didn't work. I I encourage you also to ask questions if you don't know the answers about an injector you're considering using. They're injecting your face, so it would be good to know a little bit about what really is their level of experience. You might ask how long they've been doing injectables. How many patients do they inject a week? Are they doing this full time, or is it just something they're doing on the side? Where are they going to be in a week? If you need them, you should know the answer to these questions. If it's an RN, not to say that RNs can't be excellent injectors, but an RN is not allowed to administer a prescription medication without a physician or nurse practitioner order. They need to have a medical director. And I would also ask, who is the medical director and what is their level of experience in facial aesthetics? Because sometimes these medical directors are endocrinologists, radiologists, emergency docs who aren't even involved in the cosmetic field. And I don't think personally that that's an acceptable situation. That's not really a reasonable backup. So ask who the medical director is and ask, how is this person clearing me, for what you're about to do? Because there is supposed to be an established plan of care from this medical director for you specifically. And if you haven't seen the medical director, how is that plan of care exactly being communicated? So I hope this information is helpful to you. We are happy to answer more questions. We'd love to see you at Renew MediSpa at 23B Crystal Ave in Derry, New Hampshire. Please check out the rest of our website and our specials page for our current promotions. And I thank you so much for your time.